It's quite interesting that I had a referral for consultation from a very large local authority who had just begun a very innovative and unique project to offer creative therapists, that's arts therapy, drama therapy and so on, to children who are having immense difficulties. And what they wanted to know was whether this particular project that they were doing was any good, whether it was helpful, whether it was valuable, and whether there could be any identifiable gains for the children coming. These are typically quite a difficult group of children to work with, so I was quite excited to hear that somebody was trying something very new. They also wanted to find out whether there was any advice and consultation that they could be given along the way. And I guess the most important thing they wanted was an independent view. Of course they could do a lot of these things internally, but having an independent view from a university with people applying psychology and best practice and getting expertise and advice from a psychological point of view, they thought would be very helpful for them. For me personally, I'd worked with local authorities for many, many years. I've been a principal psychologist for 15 years and an educational psychologist for longer than I care to remember. But essentially what we were applying for them was the most up-to-date literature and research evidence compared to what they were actually doing. And very importantly, some field work where we could go out and speak to the children, speak to the parents, speak to the staff, carry out questionnaires, interviews, little small groups, or as they're called, focus groups, and use psychological methods of research in order to actually evaluate what they were doing.